Hello everyone and welcome. I'm Dr. Motahare and in this episode we are diving into bronchitis. What it is, what causes it, whether it's contagious, and more importantly, when antibiotics are truly needed. We'll also discuss supportive care and one of the most frustrating symptoms, post-infectious cough, that lingers even after the infection clears. What is bronchitis? Bronchitis is inflammation of bronchial tubes, which are the air passages that carry air into your lung. There are two main types: acute bronchitis, which comes on suddenly and is often caused by viral infection, and chronic bronchitis, which is a long-term disease and typically part of chronic obstructive pulmonary disease, COPD, which occur mostly in smokers. In bronchitis, you get a nagging cough as your body tries to get rid of mucus. Your cough can last 2 or more weeks. Acute bronchitis is usually caused by viral infection and goes away on its own. Chronic bronchitis never really goes away but can be managed. Today, we'll focus mostly on acute bronchitis. Bronchitis can affect anyone, but some people are at higher risk. These are smokers or those exposed to second-hand smoke, people with asthma, COPD, or gastroesophageal reflux, some autoimmune conditions, and also regular exposure to pollutants or chemicals. Recognizing these risk factors helps us in prevention and early treatment. So, what are the symptoms of bronchitis? The hallmark symptom of bronchitis is a persistent cough, which may be dry or produce mucus. The mucus can vary in color, but this doesn't always indicate a viral or bacterial infection. It means that the mucus color cannot differentiate between bacterial or viral infection. Other common symptoms include low-grade fever, fatigue, sore throat, and sometimes wheezing. Shortness of breath can occur, especially during exertion, due to narrowing or inflamed airway. As I mentioned before, most cases of acute bronchitis are viral, caused by common cold or flu viruses like rhinovirus or influenza. Bacterial bronchitis is less common, but can be caused by organisms like Streptococcus pneumonia, Haemophilus influenza, or Mycoplasma pneumonia. Non-infectious irritants like cigarette smoke, air pollution, and dust can also inflame the airways and cause bronchitis symptoms, usually in people with asthma. Is bronchitis contagious? Bronchitis definition is inflammation of your airways. This definition is not contagious. But when the etiology of this problem is viruses or bacteria, yes, it is definitely contagious. It spreads through droplets of your cough or sneezing, just like the common cold. The incubation period, that means that the days before the start of symptoms, differ based on the infection cause, but typically it's 2 to 4 days after exposure. However, if bronchitis is caused by inhaled irritants or smoking, it's not contagious. Chronic bronchitis is another category and is not also contagious. When someone has bronchitis, it's hard to tell it's viral or bacterial based on symptoms alone. But here are some general differences. Viral bronchitis usually start gradually, may cause low-grade fever, may cause some kind of tiredness, body ache, and things like that. On the other hand, bacterial bronchitis may cause higher fever, a more abrupt onset, and productive cough with green mucus. As I told you before, the color of mucus is not reliable for diagnosis. Many viral infections may also cause color sputum. The other important thing is that prevalence of viral bronchitis is much more than bacterial. So we should think about this matter too. Most cases of bronchitis are diagnosed based on your symptoms, just your symptoms and physical exam. If your doctor suspects something more serious, like pneumonia, they may order some additional tests, such as chest X-ray or measurement of oxygen level of your blood. When are antibiotics needed? In most cases of acute bronchitis, antibiotics are not needed because virus doesn't respond to antibiotics. But doctors may consider antibiotics if symptoms persist more than 10 days without improvement, or there is a high-grade fever or signs of pneumonia or significant chest findings. If the patient is elderly or immunocompromised, you also may think about antibiotics. Clinical judgment and sometimes tests like chest X-ray help us rule out more serious infections like pneumonia. So what is the treatment for viral bronchitis? The main treatment for viral bronchitis is just supportive care. Get plenty of rest and stay hydrated. Use warm fluid and steam inhalation to soothe the throat and loosen mucus. Cough suppressant at night may help you sleep. Expectorants during the day may help clear mucus. Avoid smoking and pollutants. And use acetaminophen or ibuprofen for fever or body ache. Most cases of bronchitis are mild, but you should see a doctor if your cough lasts more than 3 weeks, or you have a high-grade fever, shortness of the breath, chest pain, or your cough has blood. If you are in a high-risk group, means you older adults, smokers, or people with chronic medical conditions. Don't ignore the red flags, especially if you feel worse instead of better. To sum it up, bronchitis can be annoying, but most cases are mild and don't require antibiotics. Your best treatment is patience, rest, and care. Thanks for watching. If you found this video helpful, don't forget to subscribe to stay updated with more essential health tips.